Hello. Hello, and welcome to our first Greater Manchester Wide Nurse Forum for 2022. May we wish you a happy, although now belated, New Year. Please, can I remind you to turn off your camera, place yourself on mute, and use the chat box for any questions. Thank you. Next slide, please, Karen. So at our last forum in October 2021, we collated all the feedback received regarding how you were feeling. And I'd like to reassure you that this did not go unnoticed and was taken further into many other arenas through Greater Manchester. Health and wellbeing is of foremost priority across both the health and social care workforce throughout Manchester, and we hope that this forum and the resources we have showcased and signposted to are available as a valuable resource for you, like the GM Resilience Hub, the Health and Wellbeing Resource Toolkit and the Shiny Mind app. You'll see some polls going up in front of you on the screen. If you can just answer them, they're just for continuous feedback for us, please. So if you wouldn't mind just answering them if you want to, or press the cross at the top to close if you don't want to answer the question. Next slide, please, Karen. So current support that's available is listed here for you and can be accessed via the links in the presentation and within the chat at the side. We do hope these will be of continued support to you. Some of the latest support that's available throughout Greater Manchester. Today's agenda is not so dissimilar in nature. We have some excellent presentations on offers available where you can get involved to both support both yourselves and your colleagues. Further, some unmissable information on the digital nursing agenda and some exciting topics in the breakout sessions with our first non-medical prescribing update this month. Just to add, we'll be trialling this new polling function throughout the agenda for feedback, where you'll be asked questions throughout to answer on screen. So thank you for participating in that. So then, without further ado, I'm really pleased to introduce Trish Hughes and Catherine Applewhite. Trish is the Deputy Director of Nursing at NHSE and also the North West Regional Professional Nurse Advocate Lead. And Catherine is a Professional Nurse Advocate. Thank you, ladies. Thank you.
Oh, hello, good afternoon, everybody, and thank you so much for inviting me. Just a brief about myself, really. I'm fairly new to the North West region in this role as Deputy Director of Nursing, and as Leslie has said, I'm a Regional Professional Nurse Advocate Lead. However, I'm also involved in looking at inequalities in health, and I'm really passionate about the EDI agenda. So anybody on the call that's got passions around that, please do not hesitate to contact me. I also get involved in international recruitment for midwives as well, so it just gives you a bit of a flavour of the things that I'm up to. I thought what I would do, I won't put up a presentation, I'll just give you sort of a brief summary of what some of the benefits of the professional nurse advocate, and then I will go to my amazing colleague Kath, because she's more frontline than I am, and I think her story will resonate more with you. So I'll just talk you through, because I'm sure you'll have a lot of presentations today, just some of the benefits of the professional nurse advocate role. So just bear with me. Slide. So some of the benefits of the professional nurse advocate role, and it seems like it sounds like it's a theme of your session today. It's about supporting the health and well-being of nurses, you know, of us and individuals and groups. It has been shown that this interaction is known to decrease stress and burnout and leading to reduced sickness absence. So there's a model of how the PNA works. It's the A-Equip model, and I can provide you with some more information. If anybody needs that, contact Leslie. And just for you to know, it is the training is at level 7. So if you've got a degree module or degree, you would need that first before you went on the professional nurse advocate course. Once qualified, so what we're looking at now, we've got, so hot off the press across the North West region, there are 206 officially registered professional nurse advocate, so that's fantastic. And we are looking at developing a community of practice across the Northwest. But I think, you know, like I say, the key points really are, this is about undertaking that training. It is 10 virtual study days, so we can look at how we can support the well-being, you know, of our workforce, which is so topical at the moment. So what I shall do now, if I'll go Kath to give more of a update from in regard to actually undertaking the P&A role. Thank you. I think you might be on mute, Kath. Well, I can't hear. Was it just me? I can't hear anybody. Can you all hear me?
Yeah, we can hear you. Yeah, but I can't hear
Okay.
Catherine. Can't hear
No.
Catherine.
You might need to adjust something on your, is it on your headphones, Kath? You might need to adjust something on there to unmute. Or you may need to take your headphones off and take them out the computer. Oh no! Kath, why don't you try logging in and logging out, and I can take some of, while you're doing that, let me tell, I can see there's some questions coming up.
She is muted. You can tell you're muted on your little.
Yes, yeah,
Can you
you're
hear me
muted.
now?
It's, oh yes, yes.
You can.
Yeah.
Okay, I'm going to try and share my screen. Let me know if it works. Can you see that?
Yeah, we can see your screen.
Yes, we can.
Oh, right. Thank you. Well, thanks very much for having me here. My name's Kath, and I've worked in adult critical care at Manchester Foundation Trust for about 25 years. So my background is critical care, but don't worry about that in relevance to you. If you're a PNA in the community or whatever setting you work in, it's relevant to you. So I trained as a PNA with 7 other nurses last year, and that was in the second cohort of the PNA training from NHS England, and that was at UCLan University, and I completed the training in July 2022. And this PNA role was set by Ruth May, the Chief Nursing Officer for NHS England. And it's about delivering training and restorative supervision for colleagues right across England. It was launched in March last year towards the end of the third wave of the COVID-19 pandemic and at the start of a critical point of recovery for patients, for services and for our workforce. We know that nurses have faced a challenging time, and there's been much evidence of its effect on our well-being, including, as Patricia said, burnout, stress, moral distress and compassion fatigue, which impact on our ability to carry out our work. And PNAs have developed the skills to facilitate restorative supervision to our colleagues and teams. A version of this programme already exists for the maternity colleagues, where the outcomes pointed to improved staff wellbeing and retention alongside improved patient outcomes. So wellbeing, it's talked a lot about at the moment, and especially when we think about the impact of the COVID pandemic. And what does it actually mean? Well, it's considered a dynamic state where individuals can reach their potential, be productive and creative, and contribute positively to others. And for those working in critical care, we knew that the nature of the work has a huge impact on our health and well-being. The UK Intensive Care Society had pointed out that about a third of ICU healthcare professionals are at high risk of burnout and post-traumatic stress. And as I said earlier, it doesn't just relate to intensive care unit. These are the stresses and challenges that every area of healthcare professionals face at the moment. There's further evidence that when individuals feel negative emotions such as stress, anxiety and burnout, it can lead to uncivil behaviours, which in turn leads to a reduction in quality of work, time at work and a willingness to help each other. And there's a huge campaign around that, which I encourage you to have a look at, called Civility Saves Lives, which is fantastic, and it relates really well to the P&A role. So the impact of poor health and wellbeing, we know, also has a huge cost burden to the NHS. It's estimated at 2.4 billion a year. So where do we go with this as healthcare professionals? Do we ignore it? Do we hide it under the carpet? Do we make do, or do we get up and act? And I believe, along with many others, that we can't ignore it. And that's why Ruth May, Chief Nursing Officer, set about to create the P&A role. We have a responsibility to make mental health an open discussion with employees wherever possible and appropriate, to create an environment in which employees feel able to talk openly, because while the psychological stress of work can lead to a myriad of consequences, it also ultimately leads to less innovation and reduced patient safety, and that's not where we want to be as healthcare professionals. So as a P&A, we hope to listen and understand our colleagues and the challenges and demands that they're under, and to lead and support and develop quality improvements in response. As I said before, the programme is the first of its kind for nursing, not just in England, but it is across the world. And at MFT, we were really excited and privileged to be one of the first trusts to implement the role. And it's gradually been rolled out across the next few years, with the ultimate aim that they have one P&A for every 20 nurses in the UK. So in critical care, we've been implementing an improvement project which will focuses on restorative clinical supervision and supports our colleagues to enable them to thrive and not strive. The P&A team at MFT, we've been using education and restorative clinical supervision to address the emotional needs of staff it supports and develop resilience. And restorative supervision contains elements of psychological support, including listening, supporting and challenging the supervisee to improve their capacity to cope, especially in managing difficult and stressful situations. Restorative supervision can provide our staff with time to reflect on their physical and emotional health and provide a safe and confidential space to explore the impact of work pressures. And it also gives an opportunity to discuss the challenges faced and new ways of working, and time out to reflect on their work-life balance. It helps to develop resilience, and resilience is about making the difference between going backwards, not going backwards and standing still, but moving forward, giving us that ability to bounce back. So my role as P&A is to implement an improvement to create a daily thinking space, a place of discussion, reflective conversation and open and honest feedback. And hopefully it's restoring thinking capacity and enable individuals to understand their process and process their thoughts, helping them to think of different perspectives and help them in their decision making. My role is to support and reduce stress and burnout and develop good, positive working environments rather than focusing on ways to help us cope with negative working environments and provide treatment when we become unwell. As a P&A, I hope to listen and understand the challenges and demands the stress the team are under, and to lead and support those quality improvement initiatives in response. And one particular area that we've been working on is an area called 15 at 15, which is every day at 3 o'clock for 15 minutes on the unit in a core huddle, we're having a thinking space. So it starts with some ground rule agreements, like turn your phone off, contribute to the group, respect each other, maintain confidentiality. And then we follow it with the grounding exercise, which pays attention to breathing and bodies. And that breathing technique allows individuals to be present in the moment and gives them a sense of peace and calmness away from that overstimulating nature of critical care. And I'm sure that, you know, if any of you are interested in this, you could apply it to your area of work. A reflective discussion then takes place using a question to open discussion. For example, what feelings are you bringing to the group today? What's been your input to the team today? And that provides opportunity to discuss how we feel, our experience of events, situations or interaction, and helps us to identify the causes of stress. It encourages us to engage with each other, use each other for support and manage negative emotions and learn from the experience. And from that, we identify common themes and priorities of where we need to improve. It's been really successful so far. It's helping us to understand ourselves better and helping us to make a different choices in the future, thinking differently. And other members of the group can help by giving their objective insight into the situation. It's helping to give a 360-degree view of how you're feeling. And it's moving us from away from anxiety into positive emotions, ready for action and responding differently in the practice situation. At the end of the session, we end it with a statement of positive reflection or intent and thank each member to encourage kindness. And for some, we know the session doesn't end there. It might be more challenging situations, conversations or emotions and feelings which we need more time for, having a one-to-one session or needing referring to employee health and wellbeing or other signposting support systems. So the improvement work and the role of P&A is all about creating compassion and kindness to build resilience. And in all areas of healthcare, our focus is on improvement and getting individuals better. And we know that our work can be damaging to us, both physically and mentally. And we can't continue at those high levels of stress and staff leaving and levels of sickness. It's just not sustainable. So there's lots of evidence that we need more compassion and kindness between ourselves working in teams, and that we need to build resilience to help us to cope with the stresses they face and improve our health and well-being. And for me, being a P&A, it gets to the heart of caring for each other. It's about what we're called to be as human beings, to be civil to each other, to build trust and respect between one another, and to build us together to be more confident, competent and empowered as healthcare practitioners. So I hope, could you all see those slides? I hope I've not just been talking to a blank screen for the last 5 minutes. Hope you found that helpful. Thank you very much for listening to me.
Thank you, Kath. Big thank you from me, definitely. Is there any more? We've got 3 minutes if there's anyone who wants to ask, put hands up for questions. Do you want to stop sharing, Kath?
That stopped?
Yeah.
Perfect.
I'd just like to say thank you very much to both of you for coming and that excellent presentation, Kath. I think it touched all our hearts there. And you and the P&A role definitely are supporting your colleagues there in intensive care. It's fantastic. And to build that resilience through, like you say, compassion and kindness, that's what we're here for, isn't it? I'd like to just, I know there's questions coming up in the chat there, Trish, and we can answer them at a later date. We can pull them off and people can keep adding to that. I'd just like to say that for primary care here in Greater Manchester, we've got a fantastic offer for you if you want to become a P&A, where we're going to support at least 15. We've got 15 places at the moment to be supported through the training at university, and to also to be supported for 4 hours a week for 12 months to undertake the role out in primary care. So if anybody's interested in joining the programme, there's one that starts at the end of February, isn't there, Trish? And there'll be more coming soon. If you just let me know, and between myself and Trish, we can get that organised. So we can send details out as well to everybody, just what that support is. Thank you.
Yeah, and these places are funded, so there's specific GP nurse places for yourselves that are funded. I think we've got 6 places, haven't we, funded for a cohort. So let us know as soon as possible. There's lots of support within the within the P&A. We've got people like Kath, we've got Karen Wilson, and quite a few. And we're all here to support you. And again, I've put my email in the chat. Please approach me if I can do anything for any of you at all.
Yeah, thanks, Trish. Thanks, Catherine. We'd really love the P&A role to grow in general practice and in primary care. So that's why we're making that extra funding available, so we can get that development of the role across Greater Manchester. So yeah, thanks again. Thank you.
No, thank you. Lovely to meet you all. Thank you. Bye. Thanks, Kath. Bye bye.
Thank you. Could you just turn your microphones on mute, please? Thank you. So we'll just move on through the agenda now. Our next speaker is Dr. Paula Bennett. Paula is the Chief Nursing Officer and Chief Nurse Informatics Officer. I hope I got that right, Paula, at Health Innovation Manchester. And she's joining us today as an introduction to digital nursing here in Greater Manchester. Thank you, Paula.
Thanks very much, Leslie. I'll just share my slides. Are they sharing? Someone just let me know. Thanks. That's great.
We can see them. Thank you.
Thanks, Leslie, because when you're sharing your screen, I can't see anything in the chat or hands or anything. So I've got about 8 or 9 slides now. And first of all, thank you for inviting me. I don't often get to spend time with lots of other nurses, so it's great to be able to share the work that we're doing across Greater Manchester with regard to digital innovation. So my name's Paula Bennett. I'm the Chief Nurse and Chief Nursing Information Officer at Health Innovation Manchester. My background's secondary care in emergency care, and I've worked at Health Innovation Manchester for the last 5 years. So we're just going to touch on oh, I can hear my doorbell going. That's typical, isn't it? I'm going to introduce Health Innovation Manchester, talk a little bit about the general work that we do, because there's a lot of work relevant to nursing, and then just spend the second half of the talk describing digital transformation and also the digital transformation work that's happening across primary care in Greater Manchester. So Health Innovation Manchester as an organisation has got a mission to be recognised in accelerating innovation that transforms the health and well-being of citizens. And we work across health and care, industry and academia, so the universities across Greater Manchester, to address major health challenges and tackle health inequalities. So it's quite a grand mission statement there. I'll get into a bit of the detail of what we do and how we do that as I talk you through the slides. So just the background, Health Innovation Manchester is just that top line there, an academic health science centre. Network, an AHSN, and there are 15 academic health science networks across England. So we're one of 2 in the Northwest. And AHSNs are about 5 years old, and they were developed to accelerate the adoption and spread of new innovation across the NHS. So there'd be pockets of great work or best practice in certain areas of the country, but the whole population wouldn't necessarily be benefiting. So AHSNs were developed as a means of kind of coordinating the spread of new innovation. So we were formed in 2017, and then in 2019, our colleagues in the Applied Research Collaborative joined Health Innovation Manchester. So we've got a network of researchers discovering new innovation, and then teams of people through quality improvement methods that can support the adoption and spread. And these are some of the things that we've been doing across the last 2 years. So we've accelerated the use of the GMK Record. We're supporting research. You might have heard about inclisiran treatment, so a new injection for the management of cholesterol that's been developed, and the implementation of that's being researched across Manchester. We've got lots of active digital responses for COVID. We're also supporting national innovations, so an eating disorder service and also services for ADHD. So that's just a kind of snapshot of some of them. So we've got core functions as an organisation that are clinical, academic, digital. We also work with industry. So if they're developing new innovations, either to support problems in practice, or they've identified where they might help roll innovations out into practice, then we work with industry to support that across Greater Manchester. We also, within Health Innovation Manchester, have got a national patient safety collaborative. So each academic health science network has a patient safety collaborative, and they have national programs to roll out. So you'll have heard about the neonatal and maternity work to increase safety. There's a focus of that nationally. There's the adoption and spread of evidence-based interventions across Greater Manchester. Could someone just go on mute there just so we can hear? Thank you. And then we've got patient safety work around medicines, around mental health, and around managing deterioration. And you can read more about all that work on the website. I've got a link at the end. So let's just get into the digital work now. So the Greater Manchester Care Record has been accelerated during the pandemic, and that's accessible now for all health and care staff across Greater Manchester, and it shares health and care information not just at a locality level but across Greater Manchester. So if you've got patients in Bolton, for example, that are getting their specialist renal support in Salford, you're able to access that information across the GMK record. So you can see all the tests and investigations that have that the patient has either got booked or had undertaken within the GMK record. That's just a snapshot of what the GMK record looks like, and I've just got a screen grab on the right hand side of the page to show you what the link looks like in EMIS. If you can see the little arrow there that says GraphNet portal, so everybody should have access via EMIS or what other local system you use, Vision or TPP or EMIS Community, should be able to click on the GraphNet portal link, and that will take you straight into the GMK record for that patient. So that was significant work that we did during the pandemic to increase the information sharing. It was bounded at a locality level, and we've accelerated the sharing now. So we've got a shared care record across 2.3 million citizens in Greater Manchester. And that just shows you the timeline of the development. So you can see there's Christie information in there. We've got the facility for COVID oximetry at home monitoring via the GMK record. And then this year, we're planning the launch of a patient held record. So through the NHS app, patients will be able to access certain fields within the GMK record. Just keeping an eye on the time. So just the last couple of slides now, just talking a bit more generally about digital development in Greater Manchester. So a lot of activity in 2020 and in 2021, more of that supporting the booking of COVID vaccinations. We've done work to understand digital maturity. And towards the end of last year, we started a digital first primary care programme. And my last two slides are just going to focus in on what that work has done. So, digital first primary care is a national initiative to increase digital access both for staff and patients across primary care. This work started probably towards the end of September in Greater Manchester through engagement with about 50 practices and the staff within those representing all the various teams that would work in primary care, and then also an extensive piece of engagement with patients to understand what their experiences of digital access have been like. And these are the work streams that are currently being developed and mobilised across Manchester. So a work stream around digital facilitators to enable all staff to be upskilled in the digital tools that are available. Building a knowledge bank for digital first primary care would also be a role for the digital facilitators. There's a work stream about improving access to services And there was in particular a review around the websites and how easy they are to navigate, and a company called Nexa who have worked with patients to understand their experiences of trying to navigate websites in primary care to either access health information or book appointments, for example. And of course significant work with patients around comms and engagement. And a work stream on engaging system providers, so how to work more collaboratively with suppliers of systems to make sure that digital workflow is as streamlined and time-saving as possible for staff. A digital first primary care PCN hub proof of value. So looking at having an area within a PCN that might work differently and to understand the benefits of that. And then finally, tech development. And that's the end of the slides. I think that they'll be circulated towards the end, at the end of your session today. And there's also a link there where you can get regular information and from Health Innovation Manchester. I think there might be a couple of minutes left for any questions.
Hi,
Yeah, there you go.
Hi, Paula. I'm Saguna. I'm a practice nurse. I'm just wondering if a nurse who's completed her master's wants to go forward with a PhD course in the area of nursing. Do you help them at all, and what kind of help is available there, please?
Okay.
Thank you.
So Health Innovation Manchester, although we are linked with the universities, you would need to directly contact the schools of nursing. If it was a nursing PhD that you wanted to do, you'd have to contact the universities, look on their website to see what was available. It's not support that we offer from Health Innovation Manchester. So it's the universities, you'd need to look at their websites.
All right. Okay, thank you.
Okay.
Paula, can I ask if any of the nurses might be a bit shy about asking questions or want to get involved with anything, because there's loads of work there that's going on behind the scenes that probably some of us have been involved in or know that's happening or would like to get involved with. Who do they contact, please?
They can contact me.
Right, that's great. So could you just put your email in the chat for us then?
Of course, I'll do it now.
And can I ask also, would you be willing to come back to another forum and perhaps do a breakout session on one of the topics?
Yeah, absolutely. I appreciate that was a whistle-stop tour, really. It's a lot to cover. And the digital first primary care is being led by a colleague of mine, actually, who's a nurse by a critical care nurse by background, but also has got a lot of digital experience. So I could certainly ask, we could do a double act between us if it was a particular kind of deep dive into the primary care digital first work. We'd love to.
That'd be great. Thank you very much. Yeah, thanks very much. Yeah, thank you for today.
Okay.
And Paula's details are in the chat there if anybody wants to contact her.
And Sagana, if you want to drop me an email as well with a bit more detail about what you were looking for, I'll be able to forward it on to some university colleagues. Okay.
Lovely. Thank you.
All right.
Thanks.
Have a great rest of your session together today. Thanks very much.
Thanks, Paula.
Bye now. Bye.
See you soon. Thank you. Okay, so moving on, I'm delighted now once again to welcome back to our forum in Manchester, Shiny Mind. And both Karen and Beck are joining us today. I don't know, is Beck on screen? Here she is, and there's Karen in the corner. Do you want to start your slides, Karen?
Yeah, will do.
Great.
How's that?
Okay, so yeah, that's it. Lovely, thank you.
Okay.
So Yeah, do you want to move on, Ron? Yeah, that's fine. That's great. That's fine. So following from our October forum and our launch of Shiny Mind, you may have been with us in October. We've currently got over 90 nurses using the app, using the Shiny Mind app. And I'm delighted again that Karen and Beck could join us again today to return with some exciting offers for you to get involved with the app and be participating in the development further of the app and supporting other nurses, not only in Greater Manchester, but also across the country. So here's the QR code if you want to download the Shiny Mind app today, and we can get you registered for that. And I'll let Karen and Beck take the floor. Thank you, Karen.
Thanks, Leslie, and thank you everybody for inviting us along today. My name's Karen Story and I'm Nursing Retention and Liaison Lead here at Shiny Mind, working with Beck and the team. And I'm on secondment from the CNO's team at NHS England and Improvement from my previous role as Primary Care Nursing Lead to further develop the app so that we can get it out to as many nurses as possible. And the reason why I'm keen to do that is because of the work that I did previously, I mentioned with primary care nurses. When we were working very closely with Beck, there's a specific part of the work that Beck does that really helps to support nurses step up into those leadership positions. And it's because of that work that I'm really delighted to be able to come and work with Shiny Mind, because we want to be able to give those skills that support their leadership development, but also that in turn support their health and well-being, that really will help nurses and also prevent some of the things that we're hearing about at the moment around difficulties and the reasons for nurses wanting to leave the profession. So we know that we've got some real challenges in the profession. We heard about that this morning from your colleague Kath from the PNA programme, and recruitment and retention of the nursing workforce is our biggest challenge. And we know that nurses have been placed under tremendous extreme pressure, and also in primary care nursing as well as other areas of nursing. And nurses are struggling with the effects of burnout, low morale, and is having a real impact on their mental health. And we know that it's a priority for NHS England and Improvement to support the health and well-being of the nursing workforce, hence events like this today. But ultimately, I think everybody is in agreement that we really want to bring that joy back to work, because we know that happy staff in turn make happier patients. So I mentioned that my secondment here is supporting retention for nursing, and it's led to this secondment. And what we want to try and do is, as I said, get this app out to as many nurses as possible. And what we're doing is we're engaging with our nursing workforce ambassador sites. So Greater Manchester being one of those, and there are a mixture of these from primary, secondary and community care. And we'd like to be able to, as I say, get the app out to as many nurses as possible, but recognising that time is of real value to everybody. We want to be sure that time spent on the app, using the app, isn't just seen as something self-indulgent that we're doing, but actually it's building up CPD points as we do it. So time spent on the app is really valuable because it's going to create those CPD points, which in turn will then lead to being able to demonstrate this for your NMC revalidation. We're working very closely with the Professional Nurse Advocate Programme, and we heard this morning from colleagues, and we want to be able to develop a restorative clinical supervision resource that sits on the app. As well as this, we're developing other life packs. We've called them life packs, but essentially they're resources on the app that will add support from a mental health point of view for things that really happen to you, not just in work, but outside of work as well. You know, the impact of divorce, grief and loss, but also some really positive things that will give you the tools that you need to be able to make some real changes in your workplace, but also in your life as well. We're doing some work with the Walton Centre in this area to co-design a living with pain pathway, because we hear all the time about nurses that suffer with MSK problems. One of the unique things about the app is that it has the ability to be able to connect people. So being part of a community helps to alleviate some of those challenges that come with working on your own in that isolated area like primary care. So a gold button messaging system will allow the lead for an organisation to communicate with all of the nurses that are on the app. We're also doing some work with our nursing students so that we can support them from the outset of their career. So we're doing some work with Keele University. We've got an event where we're launching the app with the students this afternoon. So what we're aiming to do then is, as I said, to engage yourselves, people like yourselves, through the 5 ambassador sites. What we'd like to be able to do is collaborate with as many nurses as possible to test some of these new resources that we're developing. And that feedback will enable us to ensure that the app, the resources are specific to the nurses' needs, and we'll be able to get them out to as many nurses as possible. We've got a bit of a target there at around 75%. If we can achieve that, we know that we'll be really making a difference. And what effectively we're doing is creating a movement, creating a social movement to support nurses, to help them support each other. So our ask today then, for those of you that have already got the app, or those of you that are going to download the app today, is to ask you if you will help us in this big piece of work that we've got going on. So we'd like to be able to recruit some shiny minders. These are people that are advocates of the app, that can tell others how fantastic it works for them, what an impact it's having on their health and well-being, and they can become our champions to help to promote the app through Greater Manchester. So I mentioned before that we'll be collaborating with you to develop the resources, but it means that you'll be able to have first sight of some of the resources that we're developing. And I'll be working with you as well so that we can create an engagement campaign and resources so that we can ensure that we reach as many nurses as possible. And our ultimate aim in all of this is to spread the app across to as many nurses throughout England as possible. And we've got a phased campaign to do that across 2022 and 2023. So if you become a Shiny Minder today, the benefits for you are that, one, you'll be part of a unique community, bringing nurses together to support health and well-being of other nurses, but you'll get first sight of these new apps that we're developing. I mentioned about the CPD points. You'll be the first to get them to get engaged in that, and you could even help us create some of those resources to be sure that they're uniquely mapped against CPD and NMC revalidation. And of course, you'll be engaging with other Shiny Minders across the country, creating a social movement. So I'm going to hand you over at this moment to my colleague Meg, who has created a few questions for us. We want to be able to be sure that we're creating the right campaign so that we can engage other nurses in this work. So some of you have already been testing the app, and we'd love to hear from you around how it's worked for you and making sure that we're getting these things right. So thank you very much, Megan. So the first question. Yeah. Sorry.
But everyone see that on the screen.
Thank you very much. Double technology going on here.
Yeah, I'll put the link in there, and if people can go to slido.com and put in the code ShinyMind1, and they can use the QR code as well to join it as well, and I'll put the link in the chat box.
Thank you. So you should be able to see all of these questions in front of you at once, but I'm just going to read through them and then we'll just flick through each of the questions. But we want to hear from you to see and hear how you're finding using the app. How is it working for you? So if you can pop your comments in there, it'd be fabulous. And the next question, please, Meg. So if you've not used the app, why not? It might be that you haven't signed up to it yet, but you've got the QR code from Leslie today, or you've just not managed to get there yet. What can we do to help that become more easily accessible? And the next one, please, Meg. So how should we communicate this message of support to nurses? What would you like to see? Is that by email? Is it by posters? Is it coming along to a nursing forum? What would you want us to do? And the next one, please, Meg. And what would the message need to say to appeal to others so that they would download the app? How can we get this right? Somebody's already said there, not signed up yet, busy life, busy work. But believe me, if you download the app, you might become less busy. You might develop some new skills that you'll become less busy. How about that? Next one, please, Meg. And what shouldn't the message say? What doesn't work? What wouldn't you like to see? Next one, please, Meg. And we've created some imagery here, and I know it's really tricky getting it right for primary care and for all the other disciplines. So we hope we've managed to get this right. But, you know, would this imagery appeal to you and your nursing colleagues? If not, why not? What would you like to see there? Maybe some pictures, some real pictures of yourselves? Would that work? Thanks, Meg. Next slide, please. In what ways can you help share the message that Shiny Mind is here to support you and your colleagues? What could you do? Even if you just told one other person, and that one person told another person, we're creating that ripple effect, and we're going to spread the message out there. Next one, please, Meg.
I think that's the end of the questions.
Okay, if you stop sharing, and I might have to start sharing again. Great, thank you. Over to you. Hopefully you're there.
Yeah, I'm here, and it's wonderful to see so many people here today. So what I would like to say, just to sort of, if you don't know me, I'm Beck Howard, and I'm the CEO of Shiny Mind, and I'm really, really proud to be with you today and be able to support the nursing workforce in the way that Karen has just outlined, because they're such an important part of the fabric of healthcare and indeed our society. And I think in terms of everybody in the room has gone sort of above and beyond over the last 2 years and was doing so way before we had the pandemic. Our belief at Shiny Mind is that everybody has the right to shine bright. Everybody deserves a shiny mind. And in terms of our ambition is to become a global force for good, to help as many people as possible shine brightly across all areas of their life. Shiny Mind is it's been a project of 5 years of research, working alongside the NHS, co-creating a resource, sitting with people like yourselves to find out what will help you get through a very, very busy working day, and also what will then help you have enough energy to actually join in with all of those things outside of your life, because we created this around a human, so it's a holistic view of what people need. People are not a shift pattern or a job title, they're a whole person. And so we wanted to create a resource that actually would help you be able to show up at home and then also sleep well, which is so important, and have enough energy to get back up in the morning and do the amazing things that you do on a daily basis. And that's what we did in terms of bringing Shiny Mind together and indeed to life. And our whole ethos around what's on Shiny Mind, for those of you who haven't tried it yet, is it's a discovery tool. It's a way of understanding yourself so that you can empower yourself to deal with everything that life throws at us, because life has curveballs and it can feel like a roller coaster at times. And what we found out when we co-created this with the people in the NHS was they said that in terms of trying to find resource or support, they were more likely to try and self-sort as opposed to actually ask for help from HR, because they felt it was career limiting, or indeed that actually, rightly or wrongly, and equally as a psychotherapist, they weren't going to come and see me anytime soon, because when people meet me at a party and know that I'm a psychotherapist, is that they walk away fast. So what we were doing is to actually create something that would build around somebody. So if we can move slides. And I'm just seeing some of the chat box information saying that you've got no option to register as a new user. This is a community-based app, and so it's building up a community for Greater Manchester. So the The QR code will take you to a sign up form, and then you will be emailed out your username and your password, and then you'll be able to become part of the Greater Manchester community. It doesn't work just by downloading or trying to download it on the App Store at the moment, just so that absolutely helps you get hold of it. But if you fill in the details, our welcome team will get you the app this afternoon, so you'll be able to join in. Just so you can understand a bit about how it came to be, it started with our desire to actually help people understand that when we understand ourselves, actually, and how we think and how we feel and how we behave, we understand the most important relationship any of us have in our lifetime, that is with ourselves, because that's how you experience everything else. But actually that sits in a place of psychotherapy, and most people don't ever go and do any of that stuff unless things are getting tough. So we started at the very beginning 5 years ago to help people understand just those simple things about their thoughts, their feelings, the behaviours, the relationships. And we've worked with nearly 3,000 members of staff in the NHS to actually see whether this approach works. And you can see that by now we've got 97% of people feel like more able to cope, and 96% of people feel less stressed. And we've actually assessed Shiny Mind against a longitudinal year-long study in an NHS organisation. And we can see that those people that actually use Shiny Mind find it useful so much that actually that reduces their absence levels, and actually their turnover is less high. And actually the amount of rigour we've got has meant that actually we're now actually classed as a proven innovation by the Innovation Agency Exchange, which is created by the Academic Health Science Networks. Next slide. Karen, have you got them?
Stuck.
Oh, there we go. These are just a couple of quotes just to let you kind of see the kind of impact it has for people. And these is what you'll find is that you'll like jump into the masterclass area, and this area is all about empowerment, learning and growing, so that you can start to understand yourself. Everything is backed by science and evidence based, so you can actually understand that your time on here is well spent. It will help you kind of discover all about you. And most people are really curious about, why do I do what I do? Why do I do it repetitively each week as well? So this really helps you start to grow, and actually within a few minutes, your app will actually, your version of Shiny Mind will look completely different to anybody else in the room because you're in it. And actually you'll start that process, that journey of learning, which is not only good for self at home, but is self at work, as we all grow, learn and develop. And the next slide shows you that also the other thing, and this is why it's actually set up as a community, because you are part of a team, and you're part of a team, a fantastic community of practice. And that's what Shiny Mind fosters for the nursing profession, is that when you actually sign up to this, or indeed help your team know that it's there, you can uniquely support each other in your practicing world. As you're able to find each other, send messages of support, these tiny little, almost like postcards with a nice background you choose and a font and your own message to your teams make a big difference, because they lift people on difficult days. Time and time again, we hear of people say, I was having such a bad day and I got one of these positivity posts and it lifted me. And actually it turns a bad day into a better day, and a better day into a great day. And these tiny micro moments are happening all across the NHS at the moment with Shiny Mind, really helping to support people, that connection and that fundamental want to belong. And I think the other thing to say here is we really do need your help. There are so many of you out there, and there are so many of you that would want to actually connect people with support that will help each other and indeed be there for each other, because as nurses, people, you are so good at looking after others. And this is actually enabling a way in which you can do that, but also actually take that most needed, precious time to support yourselves in terms of that self-care and self-compassion as you do everything you do to help everybody else in your world. And we need your ideas, we need your energy, we need your help to actually connect as many people as we can across Greater Manchester to actually know that this is here. And you will have ideas that we haven't thought of. We want to actually listen to you, create resources uniquely to you. So you have this opportunity to create Shiny Mind to be something even better than it currently is, to support every single nurse, part of the nursing workforce that is out there, and not just in Greater Manchester, but wider. And just to give you an idea of what could that mean, well, it means you'll go on your own learning and development programme to understand self as leader across this year as you work with us, which is fabulous. Be able to come to interactive sessions to learn more as we show you new bits of the content, and indeed you actually create the content. And just to give you an idea of the power of this, whilst we actually have assessed how well Shiny Mind was doing to support people like yourself, what we actually found is that people in the primary care setting, nurses in particular, were starting, it helped them so much, they were started to use this with patients. And we're now in cycle 2 of patient trials. It's working. And actually, that's an initiative directly related to nurses. And in terms of what that means is that as of March this year, Shiny Mind will be prescribed as a wellbeing prescription for patients. And that is a nurse-led initiative, something that has really started to see a big difference to patients, and their wellbeing is now being prescribed out to patients in the first integrated care system in Bedford, Luton and Milton Keynes. So we would really love your voice. We would love you to come and join us. We'd love you to hear your ideas, your feedback, and we'd love you to feel part of something that's making a big difference to nursing across the country. Thank you.
Thank you both for that. We have got questions in the chat box about the sign up and the forms and a number of other things, and I'm sure this group, we've got 100 and odd people here on this call. I'm sure lots of them are going to get involved with this and sign up and get involved to become a Shiny Minder, because the questions are already coming about how it could be made better. So obviously they're the people that you need on board. These are the ones you need to use it, to trial it, and to get working with you to change it for the better. So my encouragement to everybody is sign up for it, download that code. Can I just make sure, Beck and Karen, what the procedure is then? So there's I'm no tech me. So there's the QR code. So download the QR code.
The QR code will take you to a form where you sign up for the app if you haven't got it already. And then if people contact you, Leslie, I think that's probably the best way if they're interested in becoming a Shiny Minder. And then what we will do is convene, once we've got however many Shiny Minders on board, we will convene and meet and work out how we're going to create a campaign to spread the app and the message of the app across Greater Manchester. One of the things that we've been doing with the other area, Bedfordshire, Luton and Milton Keynes, they came up with the idea that they wanted to use their own pictures rather than those pictures that I showed in the questions there of images of nurses. They wanted to put their own pictures on a poster. So that's what they're doing in Bedfordshire, Luton and Milton Keynes. And they're having some bold statements that everybody's made around how the apps really help them, and their picture on a poster, and we're going to put those on loo doors in all surgeries across Bedfordshire, Luton and Milton Keynes, or send them to people digitally. So that's just one of the ideas. Another idea was they wanted to create some talking head videos. So people were prepared to say how fabulous the app was, going to share those with their colleagues. And there's numerous other ideas that are coming up, but it's really great to have those ideas in real time so that we co-produce it together.
Sounds great. Sounds fantastic. So I know there's a few people saying that there's that they're still having problems with the link and the QR code there. So I don't know whether or not there is some issue going on. But we can sort of get that sorted through the rest of the program. We're going to breakouts now, so perhaps that's something we can get up and running during the breakout so that everybody can at least download it. It's free. It doesn't cost you anything when you sign up and download it. Have a look round it. If it's not for you, that's fine. It may be at some other day, so you might want it in your back pocket at some time. But if you really do feel compelled to help develop this and to help your colleagues support them across Greater Manchester and further afield, then get involved and let us know. Thank you. Thanks both. Thank you.
Take care.
Thank
Have a good
you.
day, everybody.
Bye.
Bye.
Thanks,
Bye.
Beck. Thanks, Karen. So we'll do that while the breakout's going on. I'll fast forward to Claire now, because everybody should be starting to go into their chosen breakout room. So we'll see you back in the main room after your breakout session.